Does your sock leave a mark? That faint line pressed into your skin, a ghost of the elastic? Most of us just tug our socks off, see it, and forget it. A temporary visitor, gone in minutes while you put away the groceries or call a friend. It vanishes without a thought. But what if it doesn't? What if that little dent decides to hang around? What if it's still etched there 10, 15, even 20 minutes later? A groundbreaking 2024 Stanford study of over 5,000 adults found that nearly 70% of individuals over 55 misinterpret or completely ignore subtle body signals that could indicate developing health concerns. That faint line, which 9 out of 10 people dismiss, could be your body whispering a profound question. Imagine two futures. One where you learn to listen to that whisper, catching vital signs early, living with confidence and freedom, and another where you ignore it, risking the very activities you cherish. We're going to unlock the secret language of your legs, and by the end, you'll discover the single most critical, often overlooked clue that could literally change your life's trajectory, allowing you to stay active and independent for years to come. This crucial piece of insider knowledge is so vital. Without it, you might be missing a potentially urgent signal. So stick with me until the very end. Try. Before you even think about putting on socks, run your finger over the skin on your lower leg. Just get familiar with how that area feels normally when there's no pressure, no dent, just your skin's natural springy texture. This is your personal baseline. So what exactly is that lingering dent trying to tell you? Imagine two kitchen sponges side by side. One is bone dry, light, airy. The other is completely waterlogged, heavy, dripping. If you press your thumb into the dry one, it springs back instantly, leaving no trace. Your thumbprint vanishes. Now press that same thumb into the wet sponge. See that? The indentation holds, often for several seconds. The water squishes out of the way, creating a void, and it takes a moment for gravity and capillary action to pull the fluid back in, slowly filling the space. That little dent in your skin is exactly the same principle. It's a sign that there's extra fluid, a bit of wateriness, hanging out in the tissues just beneath the surface. Medically, they call it edema. Think of it as your body's wet sponge effect. It's like a small-scale traffic jam in your body's complex superhighway system of veins and lymphatic channels. The fluid that's supposed to be efficiently heading back up to your chest and heart is moving a little slowly. A few cars are getting backed up at an intersection, causing a local accumulation. This isn't a diagnosis, it's a crucial observation. You're a keen detective at a silent scene, and this dent is just the first clue you found. It's a single piece of a much larger puzzle we're about to put together, calmly and carefully. It doesn't automatically mean something is terribly wrong, it just means something is worth looking at, a subtle hint your body is offering. Try. Gently squeeze a bit of skin on the back of your hand or forearm between your thumb and finger. Notice how quickly it snaps back, like a perfectly ripe fruit. That immediate rebound is your personal baseline for springy, well-hydrated tissue, a healthy elasticity you want your legs to mirror. Let's do a proper 5-second check right now, together. This simple move gives you a clear piece of information about your body's fluid balance, empowering you with tangible data. Find a comfortable spot to sit where you can easily reach your lower leg. You'll just be using your thumb or index finger. Now, let's find the right spot. Feel for the prominent, hard bone at the very front of your lower leg. That's your tibia or shin bone. We want to press right over that bone, a few inches above the knob of your ankle. Why there? Because there's not much squishy muscle or insulating fat directly over the bone, so any swelling from fluid accumulation is very obvious and unmistakable. The skin and tissue are thin, making the wet sponge effect much more apparent. You can also do this right on the top of your foot, avoiding tendons, or just behind your ankle bone where the skin is delicate. Okay, Ready? Press your thumb firmly into that spot. Not with all your might, you're not trying to leave a permanent mark. Just apply firm, steady pressure. Imagine you're trying to leave a temporary thumbprint in a piece of soft clay or a stick of cold butter that's just come out of the fridge. Hold that pressure for a solid 5 seconds. Count it out slowly in your head. 1, 2, 3, 4, 5. This measured time gives any excess fluid enough opportunity to move out of the way, creating a visible impression if it's present. Try. Before you apply pressure, simply place your thumb gently on that spot over your shin bone. Close your eyes for a moment. Feel the texture, the temperature, the normal firmness. This subtle awareness helps you notice any future changes more acutely, making you a sharper observer of your own body. You've lifted your finger. Now become a meticulous observer. What do you see happening to the skin you just pressed? This moment of observation is where your detective work truly begins, giving you concrete information. Scenario 1. The skin bounces back almost instantly. It might turn white for a split second from the pressure, like a thumbprint in fresh snow, but the surface becomes flat and smooth again right away. This is what we expect to see most of the time, signifying healthy fluid dynamics. It's like making a footprint in dry, dusty sand. The moment you lift your foot, the loose grains just slide back into place, erasing your presence. This means fluid isn't accumulating there excessively, and your body's systems are managing fluid return efficiently. Scenario 2. You see a pit, a clear, visible indentation where your thumb was. That's the waterlogged sponge effect in action. It's like making a footprint in damp, packed sand near the ocean. Your foot is gone, but the shape remains, holding its form. The fluid you pushed aside is taking its sweet time flowing back in to fill the void. If you see a pit, the next question is, for how long does it linger? Does it disappear after just a couple of seconds and then fade? Or is it sticking around for 10, 20, maybe even 30 seconds? The deeper the pit and the longer it lasts, the more excess fluid is present in that tissue. You can even gently grade it for yourself, becoming your own expert. A shallow, quick fading pit, perhaps 1 to 2 seconds, is one thing, a subtle hint. But a deeper pit, one you could almost balance a pea in, that lasts for 15 to 30 seconds, is giving you stronger, more significant information about your body's fluid handling. Again, you're just gathering data, like a scientist in your own personal lab. There is no judgment here, only precise, valuable observation that empowers you. Try. If you do see a pit, make it a game to time it with a slow count. 1 Mississippi, 2 Mississippi. Get a real objective number. Jot it down. This simple act turns a vague concern into a measurable piece of data, invaluable for tracking or discussing with a professional. Now, let's get to the single most important part of our conversation, the piece I promised at the beginning that could truly change how you manage your health. This is the rare, non-obvious tip that matters most, the ultimate secret that transforms a simple observation into a potential call to action. The dent alone is almost never the real story. Think of it as a single, quiet instrument playing a solitary note in a huge orchestra. You might barely notice it, but when it's joined by a few other specific instruments, you suddenly have a powerful, unmistakable chord that demands your attention. We're looking for a symptom cluster, a team of specific signs that show up together, painting a clear picture. For something serious like a deep vein thrombosis, a DVT, which is a blood clot, the dent rarely travels alone. It brings friends to the party, and recognizing this specific guest list is absolutely critical for your well-being. This is where you become your own most vigilant advocate, safeguarding your ability to move freely and without worry. First and most critical, is the swelling in one leg only? Look at your legs side by side, preferably in a well-lit mirror or by sitting on the edge of your bed. Does one calf look visibly puffier, perhaps a bit thicker than the other? Is the ankle on one side less defined, looking more like a column than a sculpted joint? This one-sidedness is a massive clue. As the Mayo Clinic reports, systemic issues, like those involving your heart or kidneys, typically cause fluid retention and swelling in both legs, often symmetrically. A local issue, like a clot, typically picks one leg, causing an asymmetrical presentation. This asymmetry is your first red flag. Second, does that same swollen leg feel unusually warm to the touch? Don't use the palm of your hand. It's not very sensitive to temperature differences. Instead, use the back of your hand, which is much more finely tuned. Gently lay it on the calf of the swollen leg, then immediately do the same on your other unaffected leg. Is there a noticeable difference in temperature? Does the problem leg feel like it has its own little radiator inside, a distinct heat emanating from it? This warmth is a classic sign of inflammation, which your body mounts in response to a clot. Research published in the Journal of Vascular Surgery consistently highlights localized warmth as a key indicator of underlying vascular inflammation, making it a critical piece of the puzzle. Third, is there a new, weird, persistent pain? This isn't just a tired ache from a long day on your feet. It often feels like a deep, unrelenting calf cramp or a Charlie horse that you just can't stretch out no matter what you do. It's there when you're walking, and crucially, it's often still there when you're sitting still, not easing with rest. The area might also be very tender if you press on it, a sharp, localized discomfort. Sometimes you might even see some new redness or a strange bruised-looking discoloration on that one leg, a visual cue of disrupted blood flow. This pain can make simple activities like walking to the mailbox or bending to tie your shoes feel like a monumental effort. The dent, plus one-sided swelling, plus localized warmth, plus that deep, unshakable pain. That's the cluster. That's the powerful chord that cuts through all the other noise. This specific combination is the signal that tells you to make a phone call to your doctor right away. You're not guessing. You're acting on clear, unmistakable evidence your body is providing. This knowledge empowers you to seek timely care, potentially preventing serious complications and keeping you active and independent. Try. Compare your calves right now. Don't just look, use your hands. Gently squeeze one calf, then the other, with the same pressure. Do they feel different in size or density? Is one noticeably firmer or more swollen? Feel for subtle temperature differences using the back of your hand. This kind of problem, particularly a DVT, doesn't usually happen out of the blue. There's often a reason, a preceding event that sets the stage. The risk is strongly tied to one main thing, being still. Your blood is meant to move, to circulate continuously through your body's vast network of vessels. When it gets stagnant, when it pools in one area, it can get sticky, almost like honey slowing down, making it more prone to clotting. This understanding is key to prevention, allowing you to proactively safeguard your mobility. So, let's connect the dots. Think about your life over the past few weeks or months. Have you experienced any significant periods of reduced movement? Did you just have surgery, especially a major one on your hip, your knee, or in your abdomen? Surgery involves trauma to tissues, the healing process, and, most importantly, often a lot of lying around or restricted movement in the immediate aftermath. This post-operative period is a prime time for circulation to get sluggish, as confirmed by research from the American College of Surgeons, which emphasizes early mobilization to reduce such risks. Recovering from surgery is essential, but it also creates a temporary vulnerability. Have you been on a long journey, a 6-hour flight where you were wedged into a middle seat with no legroom? A 12-hour road trip where you only stopped for gas, never really stretching your legs? When you sit for that long, your veins, especially in your legs, get kinked at the hips and knees, like a garden hose that's been bent. The blood flow gets restricted, and the calf muscles, vital for pumping blood back to the heart, remain inactive. This reduced muscle pump action significantly increases the risk, making those long-haul trips a silent threat to your circulation, impacting your ability to enjoy travel for years to come. Maybe you've been sick, a bad flu, a severe cold, or some other illness that had you laid up in bed for 3 or 4 days, feeling too weak to even get up and walk around. Even that seemingly short period is enough time for the second hearts in your legs, your calf muscles, to go dormant. They aren't squeezing and pushing blood upward against gravity, which is their essential role in preventing pooling. Prolonged bed rest, even for minor ailments, disrupts this natural pumping mechanism. Other things can change the equation, too. Pregnancy, for example, changes your hormones and puts physical pressure on the veins in your pelvis. Certain medications, like some hormone therapies, can make your blood more prone to clotting. Even being very dehydrated can make your blood thicker and move more slowly, increasing its stickiness. These are all known risk factors that the National Institutes of Health routinely highlights, affecting your body's ability to maintain optimal circulation for activities like gardening or enjoying long walks. Try. Glance at a calendar. Think back over the last month. Were there any days marked by travel, illness, or major inactivity that lasted more than a couple of days? Just being aware of your own recent history is a powerful, proactive step in understanding your body's signals and maintaining your vibrant lifestyle. The best defense against stagnant blood flow and the risks it carries is consistent, gentle movement. Not a marathon, not a heavy workout at the gym, but simple, gentle movements that you can do from any chair, making prevention a seamless part of your daily routine. These exercises specifically target the second heart mechanism in your calves, ensuring your blood keeps moving even when you're seated. Let's do some together, right now. First, the most powerful one, ankle pumps. Sit comfortably with your feet flat on the floor. Now, simply point your toes down toward the floor as far as they'll comfortably go, like you're pressing a gas pedal all the way down. Hold that stretch for a second. Then, pull your toes and the front of your foot up toward your shin as high as you can, feeling that stretch in your calf. Feel that little squeeze in your calf muscle? That's it. That's the magic. That muscle is your second heart, and every time it contracts and relaxes, it squeezes the deep veins in your leg, literally pumping and shooting blood back up toward your actual heart. Let's do 5. Point down and pull up. That's 1. Point down and pull up. 2. Keep going, feeling that deliberate pump. This simple action, validated by physical therapy research from institutions like the Cleveland Clinic, is incredibly effective at promoting venous return, ensuring you have the energy for activities like climbing stairs or playing with grandchildren. Next, ankle circles. Lift one foot just a few inches off the floor so it hangs freely. Now, pretend you're drawing a big, slow circle in the air with your big toe. Make the circle as wide as you comfortably can. Do 5 slow, deliberate circles in one direction, focusing on the smooth, controlled motion. Then, without stopping, reverse and do 5 circles in the other direction. This moves the ankle joint through its full range of motion, waking up all the little supporting muscles and ligaments, lubricating the joint, and encouraging fluid movement. Then switch feet and repeat. This helps maintain ankle flexibility, crucial for balance and preventing falls, keeping you agile on your feet. Finally, seated heel-toe raises. With your feet flat on the floor again, begin by keeping your heels firmly planted and lifting your toes and the balls of your feet up high off the floor, pointing them toward the ceiling. Hold briefly. Then place them down and immediately lift your heels up high, coming onto your tiptoes, feeling the stretch in your calves. Rock back and forth like this, heel, toe, in a simple, continuous rhythm. It's a gentle, rocking motion that gets the whole lower leg working, engaging the primary muscles responsible for pumping blood. This rhythmic motion helps circulate blood effectively, preventing that heavy, tired feeling in your legs after a long period of sitting. Stop immediately if you feel any sharp pain. These moves should feel gentle, like you're just waking the muscles up. A comfortable stretch, not a strain. And, as always, talk to a clinician before starting any new movement routine if you have known heart, balance, or serious joint issues. Your safety and comfort are paramount. Try. Pick one of these moves. Commit to doing 10 repetitions every time a commercial comes on TV, or every time you're waiting for the microwave to ding. Weave it into your day, making movement a natural, effortless habit that protects your long-term mobility and vitality. Your mind might jump to the worst-case scenario. That's completely human nature, especially when faced with the unknown. But please, take a breath. That dent, that swelling, has many possible explanations. And while a clot is the most urgent, it's certainly not the most common. Understanding these other possibilities will arm you with knowledge, replacing anxiety with informed awareness. It could be a perfectly normal, albeit annoying, side effect of a medication you're taking. Many common drugs for high blood pressure, for example, can cause your body to retain fluid, which often pools in the ankles and feet because of gravity. The body's fluid balance is delicate, and certain medications can gently nudge it out of equilibrium. This is a common occurrence, affecting your daily comfort, but typically not an emergency. It could be a message from your heart. If your heart is having a bit of trouble pumping as efficiently as it used to, perhaps not quite as strongly, the whole system can get backed up. Think of a weak sump pump in a basement during a heavy rain. It can't clear the water fast enough, so it rises and collects. This kind of swelling, often referred to as congestive heart failure, usually shows up symmetrically in both legs because it's a systemic issue affecting the body's overall circulation. This affects your stamina for activities you love, like walking through a park. It could be your kidneys. Your kidneys are your body's master filtration system, meticulously balancing fluid and electrolytes. If they aren't doing a great job of filtering out excess salt and water, that fluid has to be stored somewhere. Again, gravity pulls it down to your feet and ankles, and it typically affects both sides equally, signaling a need for careful management of your body's internal chemistry. Even your liver can be involved. A struggling liver might not produce enough of a certain crucial protein called albumin, which helps keep fluid inside your blood vessels. When that protein is low, fluid can leak out of the vessels and into the surrounding tissues, causing swelling. This is a complex, systemic issue that impacts your entire body's fluid regulation. All of these possibilities need a conversation with your doctor. They are important, requiring attention and potential management changes. But they are different problems with different solutions, and they don't usually carry the same immediate, time-sensitive urgency as the symptom cluster we talked about earlier. Knowing the difference between bilateral, both legs, and unilateral, one leg, swelling is a critical distinction that guides diagnosis. If you take any regular medications, find the bottles. Just read the names. Even better, look up the common side effects for each. Being familiar with what you're taking is the intelligent first step before having a productive, informed talk with your doctor, making you a more engaged participant in your own care. When you do talk to your doctor, you can make their job 1,000 times easier. You can get to the right answer faster, leading to quicker, more effective care. The key is to stop being merely a passive patient and start being an active, precise reporter. You are the only person who truly knows the full, unfolding story of what your body is experiencing. Your personal observations are invaluable data. Don't just walk in and say, "My ankles are swollen." That's a headline, a vague complaint that leaves your doctor fishing for details. Your doctor needs the specifics, the nuanced narrative. Be precise. Be a great witness, providing concrete evidence, not just general statements. Try this approach, using the data you've gathered. Instead of a vague complaint, give them a structured, focused report. Say, "Doctor, I'm here because of new swelling in my right leg only. My left leg is completely normal by comparison. It started about 3 days ago, and I've noticed it seems to get worse by the end of the day, making it harder to put on my shoes." Then add the objective data you gathered from your self-assessment. When I do the press test on my shin, the dent it leaves stays for about a slow count of 15 seconds. The area on my calf also feels distinctly warmer than my other leg when I touch it with the back of my hand. And I've had this persistent, deep ache in my calf. I describe it as a 4 out of 10 on the pain scale that doesn't go away even when I rest or elevate it. See the profound difference? You just gave your doctor a brilliant, concise, and incredibly detailed report with all the key clues. You've pointed them directly toward the right set of diagnostic questions and necessary tests, saving precious time and focusing their expertise. This kind of clear, objective communication is one of the most powerful tools you have for your own health, ensuring you get the most accurate and timely care to maintain your active lifestyle. Try. Open the Notes app on your phone. Create a new note called Health Log. The next time you notice something new or unusual in your body, jot down the who, what, where, when, and how it feels. It's an invaluable personal record that transforms vague concerns into actionable intelligence, empowering your doctor and protecting your well-being. So, let's go back to where we started. That simple line from your sock. It's not an indictment. It's not a verdict of doom. It is not an alarm bell shrieking in the night, demanding panic. Think of it as a gentle, polite tap on the shoulder from your own body. It's a quiet question, not an urgent demand. It's just asking, with a soft voice, "Hey, could you take a look down here for a second? Something feels a little different than usual." It's the check engine light in your car. The light itself doesn't tell you if you have a loose gas cap, a minor sensor glitch, or a major engine problem. It just tells you it's time to pay attention, to investigate further, and not ignore the signal. It's your cue to gather more information, to look for the other clues, to check for that critical symptom cluster we discussed. You're not looking for trouble. You're not becoming a hypochondriac, obsessing over every minor sensation. You're just becoming a more observant, more engaged partner in your own well-being. You are replacing vague, free-floating anxiety with specific, useful, empowering knowledge. And that is an incredibly powerful shift, allowing you to live with greater confidence and peace of mind, knowing you're prepared. Your body is talking to you all the time in 1,000 different subtle ways. Our only job is to learn its language, to understand its whispers before it ever feels the need to shout. And by taking these few minutes, you just became a little more fluent, a little more confident, and a lot more in charge of your own vibrant health journey.